So I'm curious, Lisa, how many frequent flyers do you have in your family health team?
About 200.
And percentage-wise, what does that equate to?
About 10%?
Really? Is that an increase or a decrease over the past few years?
That's an increase.
Steady trend?
Yes.
And what would you attribute that to?
Aging population for one. We lost our diabetic nurse, and our community partners are pressuring us to support these patients. We have one hospital in the region, and the emergency room is being choked with chronically ill patients who don't have a family physician. We need to enroll these patients to take the load off the emergency department.
And so if we look at where you want to be, say, 18 months from now, are you looking to maintain the number of frequent flyers, reduce the number? Do you have a goal in mind?
We won't be able to reduce this number, but we have to find a better way to absorb some of them effectively into our primary care practice.
And if you could achieve that, what would be the direct benefits to the FIT?
We would decrease the gridlock in our system and caseload on our healthcare staff.
And is that impacting the quality of care you give to patients?
Sure it is. Increasing wait time for patient appointments.
And in terms of losing the diabetic nurse, what other resources are you short on within the FIT?
We need better access to specialists for our chronic disease management program. We don't have a COPD clinic in the region to help patients with chronic lung disease. We don't have specialists that treat that in town.
I could see that concern. Any other issues?
There are times when we are looking for a particular skill set in the area of mental health care that just isn't available locally.
And how are you doing with delivery of preventative care services, understanding that losing your diabetic nurse is a setback?
We've got a big hole to fill with our diabetes management and prevention program, but we do have a strong program in the area of congestive heart failure.
And in a specific way, what happens if you're not able to address these needs? What happens if the trend continues?
Our clinics are busier. Some of our patients are coming back not as well. They end up in the hospital sicker than they need to be, and that causes some frustration between the hospital, admin, and family health team.
So I'm hearing you say that if you can get access to a wider range of allied healthcare resources, you can improve the quality of care and leverage those resources and those that you already have in a better way?
Yes, that would make sense.
So based on what you're telling me, I recommend that the next step be for me to meet with your clinical team as well as your telemedicine coordinator to get their view and to discuss some specifics that OTN could address with them, reducing wait times and better relationships with the larger local health community.
Sure.
Great. So if you could let them know that a guy with a funny name is going to be calling, what I'll do is I'll circle back with you when we're done. And in the meantime, if you have any other questions or programs you want to explore, just let me know.